Hello, I am Dr. Sunil Kumar Swain, Pediatric Cardiothoracic Surgeon at Apollo Hospitals Jubilee Hills, Hyderabad. This is regarding baby Kyra, 1.5-year-old. She had a congenital heart disease for which she contacted us. Initially, we had a video counseling. So, we discussed about the reports, whatever she had from Fiji. And then over that, we discussed what are the cardiac problems inside the heart. And as she is having Down syndrome, it was little bit of late presentation because earlier is always better, and she is close to 19 months now. So that's the reason when she presented with this cardiac condition, I explained them in detail, and I explained them about delayed presentation and its outcome. And since birth, she had a recurrent cough and cold and chest infection and severe failure to thrive. She was known Down syndrome diagnosed after birth, and then because of this repeated cough and cold and chest infection, she was evaluated and by a cardiologist and found to have Down syndrome with large ventricular septal defect, large atrial septal defect, and large patent ductus arteriosus. So because of the 3 lesions inside the heart, which is a hole in the upper chamber of the heart, hole in the lower chamber of the heart, and there was a abnormal connection, all the 3 levels, because of all the 3 levels of shunt, so excessive blood flow was happening to the lungs. Because the blood flow to the lungs were more, the pulmonary artery pressure, which is called pulmonary artery, it is the artery which carries blood from heart to lungs. So that artery pressure was very high because the excessive blood flow was happening to the lungs, and lungs were started getting the bad effects of this excessive flow, and that was the reason the child had a recurrent cough and cold. So when they contacted me, that was a very bad time. It was the COVID time, so everyone was apprehensive how they will come and how the treatment will be done, and they took a lot of pain to come here because multiple times their flight got cancelled. But finally somehow she was accompanied by a doctor, and then they reached via Dubai to Hyderabad. And after coming here, we evaluated the child again from cardiac point of view, and then we found that the diagnosis was more or less same, which whatever was the diagnosis in Fiji. And after coming here, once we evaluated, I discussed with both father and mother about the child and about the heart condition and what is the outcome going to be in the future, and what are the risks involved in this type of surgery, as it was a very bad subset with delayed presentation. So fortunately everything went well. Surgery was uneventful, and all the 3 holes were closed. And immediately after surgery, on the table itself, on operating table itself, we found that her lung artery pressure has significantly come down, which was almost like systemic pressure before surgery, and immediately after surgery it has come down to 50% of that level. So she was on ventilator as per the routine norms after surgery, and then she recovered very well. We were expecting some post-operative lung related issues, but fortunately everything happened well. She was extubated on the first post-operative day. There was not much bleeding. The inotropes were very less. After extubation, she was on high flow for a couple of days, and slowly she recovered and she came back to the normal stage. Post-operatively, we did echocardiogram, which showed that all the holes were closed without any residual defect. There was no residual VSD, there was no residual ASD, there was no residual PDA. Her pulmonary artery pressure came down to normal. And because of the large patch, there was some ventricular dysfunction immediate post-operatively. The ejection fraction was around 20% immediate post-op, which came down to normal. It improved to normal within a period of 1 week. And now her ejection fraction is 60%. The ventricular function is normal, and she recovered very well. There is no residual problems, and she is happy and ready to go back to Fiji. Thank you.
Hi, my name is Shalini Madhavan. I am from Fiji. This is my daughter Kyra Madhavan. We have come here for her surgery. As Dr. Sunil has mentioned, she had a large VSD, a large ASD, and a PDA as well. We have been trying to have a child for 12 years, and we conceived after 12 years of marriage, and she is very special. Upon her birth, we discovered, the doctors had discovered that she is a Down syndrome baby, and upon checking for all issues associated with Down syndrome issues, they found out that she has a congenital heart disease, and she was born during the pandemic, so it has been very difficult for us to get her the help she needed. We have been trying for almost 1.5 years now. She is 1 year 8 months now, and we have struggled a lot to get here, and we have contacted various hospitals in India, and we found Apollo to be the best and suitable for her. And after looking into Dr. Sunil Swain's surgery expertise and his experience, we had decided to come to India to Apollo Hospitals, and we are very grateful for him to accept her case, since other doctors did not want to. We traveled for 3 days actually to get here, and it has been a long travel. Upon getting here, the doctors and the nurses here are really superb. I would like to thank Dr. Meena Trihan as well. She has done a great job for my baby, as she was a part of the surgical team when she was in surgery. And even the ICU nurses, we were not able to go into the ICU to see her. It was just a 5-minute visit every day, so they have taken really good care of my daughter. And a big thank you to Apollo Hospital for accepting our daughter's case, and also Dr. Ramesh. He's a gastroenterologist. Upon Kyra's checkup here, they did an abdominal ultrasound, and it was discovered that she has got gallbladder stones. That was numerous stones, and Dr. Ramesh had recommended to put her on medication, as she did not need surgical intervention, and we have to give her the medication for 3 months, then she should be okay. For that, we are thankful as well. So in general, we would like to thank the hospital and its team of doctors and nurses who have helped us out to get through this, and the expertise and experience these guys have is really remarkable, and we just want to thank them a lot, because we have been struggling a lot to get here. That's all I would like to say.